Hi, I'm Lorena Cabrera, and today I will be presenting Zoila's strategic proposal. We wanted our logo to express that there are no cycles or circles that women cannot break free from when they feel confident about themselves. Zoila is a female led tech company, and I am the founder and CEO. For the past 5 to 10 years, I've been working around the world learning about different economic sustainability models, and I fell in love with social entrepreneurship. For the past 3 years, I worked at Uber, where I learned about the impact of technology in scaling solutions. A little over a year ago, I left Uber with the vision to create Zoila, a platform that helps improve the quality of life for women through technology. We want our girls and boys to have equal opportunities to complete their education and access the job market by creating awareness about the woman's body and reproductive health and working with the public and private sector to create data driven policies to reduce gender inequality through technology. Why do we exist? Sadly, 15% of Latin American pregnancies are women under the age of 20. Our region has the second highest adolescent pregnancy rate in the world, only following Africa. However, 70% of students in the region do not have access to sexual education through the public system because of cultural and religious taboos. Furthermore, there isn't enough information, and the little budget the public sector has to reduce gender inequality is often used in an inefficient way because of lack of data. We want to create online tools that will give vulnerable girls access to sexual and reproductive health information in a cheap and scalable way. Through our five main pillars, which are guidance, gaining their trust, all through a customer way, which is enabling private conversations, educate them to empowering them about being a woman and the opportunities that such have. Our beneficiaries are underserved Latin American young women from the ages of 13 to 18. We really want to focus on teenage pregnancy prevention. But who are they really? We wanted to understand the needs and pains of our beneficiaries and users and created this brand personas through interviews, articles, and information collected about our target audience. Meet Andrea. Andrea is 13 years old, is currently in middle school, and lives with her mom and grandmother and four siblings in Pedro Brown, the outskirts of Santo Domingo in Dominican Republic. She wants to be a doctor when she grows up. Currently, Andrea doesn't have any electronics of her own. She usually uses her mom's phone when she gets back from work or uses the computer at her school. Andrea uses Facebook and watches YouTube videos because it's easily accessed with her mother's phone. Her main motivations to use Zoila is because her friends are talking about sex, and some are even pregnant. Andrea is single and hasn't had sexual relationships, but is curious and wants to learn how to take care of herself. Andrea doesn't have her own cell phone, and it's hard to look up sexual education content. She doesn't want to leave a history that might make her mom think she's having sexual relations. Like she herself told us, I still don't have a boyfriend, but would like to know about sexual relationships for when I do, I can take care of myself and go to college. This is Raisa. Raisa is 17 years old and is currently in middle school. She lives with her mom at her mom's house with her daughter and three siblings. Her mom supports her and the baby until she finishes high school and gets a full time job. Raisa wants to become a teacher. She currently has an Android smartphone and uses computer in school. She uses WhatsApp to chat with her friends, uses Facebook to stay updated about her local community, and sometimes uses Instagram. Her main motivation is that Raisa is single and sexually active with a small daughter. She doesn't want to get pregnant again, but she owns her own smartphones and uses mainly when she has Wi-Fi because she has limited data plan. She wants to be able to track her period and learn about STDs. All she knows about sexual relationship is informally. She doesn't feel comfortable looking online and going to the doctor is too expensive. Jaisa says, I had sexual relationship without a condom several times before getting pregnant, so I thought it wouldn't happen until it did. What is currently out there does not respond to Raisa's or Andrea's need. They're either too expensive or only live in an app, which Raisa or Andrea don't have the internet data or sometimes even the phone to use it in. Zoila is the only woman health platform in the region targeted for middle class and low income female population. We provide three services. Our main service is sharing updates on menstrual cycles, detecting sexually transmitted disease through relevant questions, and providing sexual education content, all through a social media enabled chatbot. Our B2B or non governmental and governmental sector service gives access to Soila's chatbot for institutions beneficiaries through a monthly subscription online platform where they can track relevant metrics and data in order to design data driven policies and budget allocations. Our third service is corporate social responsibility, where we design CSR strategies for startups and corporations interested in gender empowerment through Soila's online platform. Our main activities is to build AI that predicts the menstrual cycle, write and illustrate educational content messages, update and feed our logic charts of the AI, collect and analyze data from beneficiaries' interactions, build and sell corporate social strategies for private companies, and feed the monitor data visualization software for companies. Our main outcomes in the short term is to increase access to sexual education, reduce unwanted pregnancies, and in the long term, reduce gender gap by decreasing sexually transmitted diseases, increasing high school graduation rates, college enrollment, and household income. Our business models, key partners are WhatsApp for Business, Tableau or other data visualization softwares, universities and think tanks, gynecologist associations, multilaterals such as IDB. We already went through our key activities, and our value prop is to create online tools that will give vulnerable girls access to sexual and reproductive health in a cheap and scalable way. All of our customer relationships are personalized relationships with frequent interaction, except for our P2P model. We've already went through our customer segment. Our revenue streams varies in our three different services. For the P2P is a premium service for 199 US dollar or a yearly subscription service for 24.99 US dollars. Our B2B plan varies depending on the number of beneficiaries and the size of institutions, as well as our corporate social responsibility plans that varies from startup to small and medium enterprises to big corporates. Our social media is our biggest channel, and our cost structure is mainly composed by staff, illustration and animation, CRM, analytical software, WhatsApp for Business, AI design and maintenance, and online marketing. Our unit economics is of 2 cents per interactions. Our budget is first year of operation expenses, which adds up to 100,000 USD. Our cash flow at the end of the year, after reducing operating activities and in taking revenues for the first year, is of $100,000, mainly because, as we see here, we will be asking terms of equity through notes payable the first year of operating expenses of a total of $100,000 given back, paid back to investors at a 5% rate of $1,600 in the first year. Zoila was conceptualized as an easy and cheap way of scaling access to sexual education. We believe that developing strategic partnership will allow us to gain experience and visibility. We are still in the pilot way, but have received interest by big organizations such as Plan International. The biggest issues we're trying to solve and barriers we're trying to break is that culturally, sexual education is a taboo in Latin America because of cultural and religious taboos. It is increasingly harder and more expensive for NGOs to create relevant content for teenagers through offline channels, and they're all looking to convert to online ways.